And sometimes the OPQRST doesn't always, sometimes it's kind of hard, they don't always pertain to the trauma.
Mm-hmm.
So, you can ask him like if he has any pain, because you need to get your chief complaint.
Okay.
Are you having any pain anywhere? Since it's a fall and not so much, how's your breathing, you know?
So are you having any pain in place?
Just my back.
Just your back? So the onset is just totally out of the question here.
It can be, or you can say, so was the pain, was it did you suddenly feel pain as soon as you hit the floor? Did it gradually? I mean, that's the only other kind of way I know how to, because it's pretty gradual. You know that he didn't gradually fall to the ground.
Right. So it's pretty sudden.
Right.
The pain was sudden, I take it, from the fall. Okay. So what makes it worse? What makes it better?
Moving makes it worse.
What makes it worse?
Standing still or sitting still makes it not hurt, so it makes
So-
it better.
So is it a throbbing pain, a
Yeah,
sharp pain?
throbbing pain.
And where exactly is the pain?
Center of my back.
Center of your back. Does it go anyplace else? Is it just right there?
Kind of radiates up and down my back.
Down.
Throbbing is in the middle of the back.
Center of your back, the spine area. One on a scale of 1 to 10, 1 being no pain at all, 10 being you're having a baby.
8.
They wouldn't know what that would feel like. Yeah. How many babies have you had?
I got mine.
How many have you had?
No, I had a dry socket.
Oh, I've heard that hurts.
And the dentist told me, he had his nurse come in and sit down on top of me. He was in the military because I'd have punched him. And he said, this is going to be the closest you could ever come at getting childbirth.
I've heard appendix bursting is the closest thing.
Well, I've heard passing a kidney stone, so there must be lots of.
Lots of things.
So if it's anything like that, our women are
I
something.
had friends say dry sockets didn't hurt. I had friends say they were miserable. I had both. I had a girlfriend tell me she didn't think they were bad at all.
Never
Have
had.
fire tolerances.
Yes.
Yeah.
Very much.
Not all of them, but.
Well, about what time did this happen? Did this incident happen?
About an hour ago.
An hour ago.
Laying here for
So
a
we're-
while.
That's when you start laying into your, why did you sound cold?
Right, you know? Just what's taking you so
Tried
long?
to walk it off. I couldn't get up.
Have you taken anything for the pain? That's a
No.
dumb question because he's lying here. What, why would you even ask
Well, they could have like
I
got
had
up
my
after they fell and
Wife run me
then,
some pain meds. I had some
maybe they
morphine
got
in the
up and
kitchen counter.
I don't know, got some Tylenol or something other. You just never know.
Okay. Has anybody assisted you with any?
Yeah.
So, signs and symptoms, do we have to ask that question?
Your signs would be, anything that you can see. You already know that he's
Yeah,
having a
you're
symptom
gonna-
of back, his back hurting. But like if he's making facial expressions, like when you are doing your blood sweep or as he's trying to talk, you might get like a sharp shooting pain and you can tell that, and you can ask him if he's having any other problems, like any nausea, your head hurt, anything like that would also be a symptom.
Okay. Any nausea, any headaches, any pain at all besides that? Your neck's moving pretty good, by the way, so I want to rule out any spinal injuries.
Get up.
Get out of here. Do you have any allergies?
No.
Any medication that you're taking? Do you have pre-existing conditions? Do you have any pacemakers? Any
No.
Nothing going on right now? I take it there's not a history of people falling in your family.
No, it's my grandparents.
When was the last time you ate or drank anything?
I had lunch about 3 hours earlier.
Okay. What were you doing before you had this fall?
Painting.
I will just state what vitals that you would do without looking at your sheet.
Sure. Blood pressure. I'm gonna do his radio. It's called rate rhythm. On those
Rate, rhythm, and
rate rhythm. Quality.
Uh-huh.
You're so good. Respirations.
And what are you looking for?
Equal chest rise.
But when you're just counting the respirations?
Yeah, I am counting.
Right, when you're counting and what else, or what are you looking for?
Oh, his chest cavity, his full inflation of his chest cavity, equal and bilateral movement.
Rate, rhythm, and quality.
It's all rate, rhythm, quality, right?
Right, but when you're actually taking it for 30 seconds, you're looking for rate, rhythm, and quality. When you do your physical exam, you're gonna be checking all that too to make sure that you got good equal chest expansion and all that other stuff. So right now you're just looking for the rate, rhythm, and quality during the vitals.
Okay. So when I tell you, would I actually go through and do the vitals and all this
You
stuff?
would, or sometimes, I don't know, they may end up giving you vitals, or they may say you can have a partner take vitals. But if they do say that you can have a partner, partner will not do it until you prompt them and you tell them exactly what you want. Just like what you're telling me, this is what your vitals, so what other vitals do you want? You got your blood pressure, your respirations, and your pulse. There's 2 more. Skin. And what are you looking for the skin?
But then we just do this? You want to make sure it's just warm and dry and
Color.
Color of it. It's not
Color,
equal.
temperature, and moisture.
Okay.
Those are the 3 things that you're looking for, because that can all change too. Okay, and then the last one.
I have no idea. I'm not gonna even lie. Oh, you have pretty eyes. Is that what you? Yeah, those are eyes. Not his eyes.
What are you looking for with this eye?
Pearl to make sure that they're equally reflective to light.
Reactive, yes, yes.
Reactive to
So
light.
that's what that's what you're gonna ask, and that's what you're looking for. So now, say that so-and-so's doing your vitals or whatever. After your vitals, then what do? You're gonna reassess.
On a trauma patient every 5 minutes.
That'll be after your radio report. You're gonna reassess your,
What is this back here?
That's what we get to go through.
that is your physical exam. This is what I'm talking about. Number 21.
Transport to see.
Right. So, based on the findings that you have already gotten, what kind of transport decision are you making?
Mine's gonna sign in. No, right.
Are you gonna continue with the ALS and rapid assessment? That's what they're
It'll be
looking
the
for.
same. Okay.
That, yeah. I'm gonna go ahead and continue with the rapid assessment and continue to have ALS and RAP.
Okay.
So, that's what they're looking for. Now you can go into your physical exam.
So start back all over from the, and work it back down again.
You just start the head, like decap BTOS, like peel.
Oh, wow.
Nose, eye sockets, all that good stuff.
And I'm just gonna verbalize all this as I say it, as I do it, I guess. Okay. So, I guess we'll assess the head. I guess the symmetry of the expression is facial. Make sure there's not like any signs of stroke or anything, drooping face and all that kind of stuff.
Stroke mostly, I think, for medical, unless for whatever reason they say that he was just walking along and just fell and couldn't talk to me, you know. Depending on what the mechanism is, then you could do a stroke screen, but he just fell off a ladder and he's talking to you, so you know that that's pretty much ruled out.
Okay. So you
But
just
that's
say,
a good observation.
you say, what would you say as far as, you know, if I look at his face and I'm moving out the stroke part of it?
You can say that you're just gonna look for any grimaces or anything like that, like whenever you touch in an area, and you're gonna watch his facial expressions to see, okay, well, I know that that's where he's hurting, or he's got some pain there that.
Do you have your trauma sheet or do you have your medical sheet?
This is the trauma sheet.
Oh, okay. Because I was going to say, because that, it's like, I thought it was different than that. Never mind.
Yeah, it's kind of, you know, because when you're looking at this, I'm going to physically touch his face.
Yes.
Right.
It's more physical instead of just,
Right.
You feel it? Do it. Will I ask him if he feels any pain, or am I
yeah,
just
you can
watching?
just, and you can also tell him, just let me know if there's any pain anywhere that I touch.
Okay. Feel any pain here?
You can walk down the bridge of his nose, just sure that there's no instability, any
Jawline.
crunching, cracking.
None of that.
Right.
So then, I would assess his neck.
Right. In the head though, you're gonna take your pen light and you're gonna look in both ears to see if there's any cerebrospinal fluid coming out. Look behind his ears to see if there's any bruising, which are called battle signs. That's a late sign. Just shine it in their nose, see if there's any blood visible. You can have them open their mouth, make sure there's no teeth that are loose or something that could potentially,
And we can do
occlude his
this
airway.
all in how long?
20 minutes. It goes really fast.
Once you get it down, I'm sure it does, but
It does,
now
it really
it's
flies
no
by.
way.
I think I'm missing something because man, that was really quick.
So would I actually move his ear or, because we
You
can't?
can just look behind, just a quick look. You don't have to spend a whole lot of time on it. Now you can go down to the neck. And what are the 5 things that you're looking for on the neck?
I'm looking for the JVC, looking to see if these are extended or below the JVD. I'm looking at his trachea, make sure that it's not crushed or
Moved to the
moved.
side,
What's
deviated.
deviated, that's the word I'm looking for. I'm gonna check this area here, what they call it, that sub-Q.
Subacute emphysema.
Yeah.
Mhm.
What else am I gonna look for? I'm gonna look for somebody to help me.
Okay, yeah,
Stoma. To see if he's got any med alert.
very good.
Right, that's.
Those are the 5.
Okay.
Okay, and then we're gonna measure our C-collar.
We showed him how to do this when you were out there, but we couldn't remember when you're measuring it, when you go back to this, if you,
Do it from the top or the bottom?
Yeah.
Because she put it all the way big on me.
Oh, like,
because she did it upside down. She knew how to do it, but when she did it upside down.
oh, yeah, you start at the bottom.
Okay.
Short is at the bottom, tall is at the top. And you don't go like on there, you don't rest your hand on their shoulder, it's like kind of like right above.
Yeah.
You wanna go visualize like where the collar's gonna sit, and it's gonna sit like just right above his shoulder, it's not gonna be resting right on it. So you just kind of put your hand there and you go all the way up, however many fingers it takes to go all the way up to his jawline.
That's gonna be 4 for me. I don't think he's a 4.
Yeah, that one's probably already set for me, to be honest, isn't it?
Well, and you can don't always just put the collar on, if it's too big, if they start moving their head back, it's you can take it off and then readjust it, okay? Usually, what I suggest is if they measure like at a tall, I would go down 1. Because when they lay down, it is still different than when they sit up. Come on back. Okay, that's right.
Neck.
The easier way is to come up, see here's the
I
chin, the
haven't
chin's
seen
gonna
this
sit
one.
right here. So it's easier, and see, neutral, and then you can just tuck that right behind.
No, that's not what I'm moving it.
Yeah.
Awesome.
Okay. Well, I guess Scott's ready for us, so.
Thank God.